Hi, I'm Julie Jones. I'm the Director of Nutrition Services for Ohio State's Wexner Medical Center, and I've been here for 25 years on the great campus of The Ohio State University. I'd also like to introduce Kent Hess, who is our Associate Executive Director for University Hospitals, Randy Allen, our Chief Financial Officer for University Hospitals and the Ross Hart Hospital, and my supervisor, who is Mary Angela Miller, who's the Administrative Director in University Hospitals. The renovation project here at Ohio State has really been years in the making. It's a very complex project that really required us to think about not only what our current needs are, but what our future needs are. Our vision really was about creating a very dynamic and flexible model for the medical center that will last for many years to come. So as you are today looking at one of our hospitality centers for our new dining on demand program, so that we can offer a room service style program to the patients in our facilities, and we will number about 1,400 beds that we will cover at the end of this project. We are a cook-chill facility, and that is one of our strengths that we tried to build on with our consultant groups. So the equipment that you see was really allowing us to take advantage of that and bring food up into what we'll call a final hospitality center or finishing kitchen that will allow us to create foods to order. We, as part of our plan, created communities of healthcare, allowing us to create smaller kitchens that allow us to serve different types of patient groups, from our cancer patients to our heart patients. So as part of that, we ended up with spaces, these final finishing kitchens, out on our patient care units. So in working with our hospital administrators and trying to identify where these spaces could be, it was a constant series of negotiations as part of that project.
Some of the challenges that I faced with this project, and it wasn't just me, but again, it's the finance team, was we're comparing this with many requests for equipment. But as we look at things that affect patient satisfaction scores, that affect our staff satisfaction as well, this ranked up there pretty high. I don't think you can have either satisfaction of patients, visitors, family members, or staff if you don't have a exceptional and top-rated nutrition department.
I think one of the things that we tried to do when we started the project was get our arms around what this project would look like. So it was, what all do we need to be able to do the renovations, to figure out what kind of staff we needed to have, and the technology behind it. So I think we were pretty good from the team's perspective in figuring out, we think we got our arms around it, but where I really needed a lot of help was from Mary and Randy and Kent, is to say, now what do I do with it? How do I package it so it makes sense for other people?
Right, and I think our biggest concern was being able to translate it into something that we could sell. Mm-hmm. So, when you're making a capital investment of this size, you have to understand it well so that you can show others that you believe in it, and it should be financed, and it's the best thing for not only our future in terms of services, but the patients and their satisfaction, all those things together. So I think that was the challenge from our perspective, is making sure we understood it well enough and believed in what we were doing so that we could sell it to others.
I think that belief part is so important, because we always have good ideas, but I wanted to be convinced that in order to sell this, that we were sure it would accomplish what we set out to do, that we weren't just saying this is a good idea and if you give us $12 million we'll make it happen, that we'd done our homework to say that if we put this, and this in place, we will be able to achieve these particular goals. So I needed to be convinced that it would deliver on what we promised to deliver overall.
Usually you would think the finance guy would be worried about selling it, but actually I wasn't, because the work that you did and your team did pretty much sold itself. I think when I first got involved in this, mine was looking for a solution to what I saw as a problem that was coming about, just the fact that we were building a large facility and there was really no plan to build a new dining facility in that hospital. So I think that was that was the point where I felt I needed to get involved, to bring that to some of the other decision makers, that we had a solution here, and I think we came up with a good one.
And the point that Randy made is, this was not for a new kitchen. This, we have to keep our current kitchen operational over the 3-year time frame really, and continue to serve those meals every 5 hours as we renovate this or move this or relocate this and change our service over here. So that, I think, really was the complexity of it, is how we built the new building without a new kitchen. With a project of this magnitude, I just can't imagine going it alone. And with AHF, you never have to worry about being in it by yourself.
As part of this project, it was important for us to use a number of the member tools available through AHF. You know, from the time that we spent networking at both annual meetings with both other members and operator members, as well as vendor partners, to really understand what some of the changes and things we needed to consider in our own plan. I think that was really invaluable.